Even I will tell we are live now, then you can start.
Yeah.
Yeah, you can start. We are live.
Good afternoon, everyone. This is the first CME session of the 8th and final day of Med-Invade 2021, brought to you by SMR in association with JP. Today we have with us Dr. Rahul Tanwani to speak on the topic doctor-patient communication. Dr. Tanwani, he has done his MBBS and MS surgery from NSCB Medical College, Jabalpur, and MCH Pediatric Surgery from BJ Medical College, Ahmedabad. He is working upon the subject of doctor-patient communication since last many years, and he has also presented lectures and workshops on this topic in various medical colleges and hospitals across the country. In 2014, he has also written a book on the subject, The Skills of History Taking, whose third edition has been released recently. We are honored to have you with us, sir. Over to you, Dr. Rahul Tanwani.
Even please mention that.
Sir will not be able to switch on the camera due to some technical issues, but will proceed and sir will be with us. Sir will be presenting to us through audio also. Over to you, sir.
Yeah, thank you, Ravan. Good afternoon, everyone. And I must begin with an apology. Extremely sorry because of some technical fault which was detected on 11th hour. I'm unable to switch on the camera. There's some fault in it, but doesn't matter. My speech and slides, they are more important. So first of all, let me begin with thanking the organizers, SMR, JP Publication, thanking everyone for organizing this event and for giving me a platform to speak upon my favorite topic about doctor-patient communication. Just to confirm, Ravan, what about my voice? Is it clear?
Yes, sir, you're clear, sir.
Okay, thank you very much. So let us move to please confirm screen visible.
Yes, sir, you're good to go, sir.
Okay, pointer visible.
Yes, sir. Yes, it's
okay,
visible.
fine. Thank you very much. This is as he told that I've been working upon this subject of doctor-patient communication since last many years. And let us begin with this presentation with a biggest misconception. Yes, you have clearly heard me. I'm talking about misconception of this quality, good communication skills. Because if you ask any any medical student or any young doctor that do you have got good communication skills, mostly invariably the answer will be yes. My communication skills are quite good. Why? Because I'm quite gentle, I'm kind, I'm polite, I'm humble, I'm sympathetic, and many more. So unfortunately, no doubt these qualities are quite essential in our profession. But unfortunately, it is wrongly considered that if you have got these qualities, that means your communication skills are good. Well, let me begin with this correction only. And that is why I'm saying that this is the most important. Before we proceed ahead, we have to understand that what is the actual meaning of communication skills, or on which I've been working since last many years. Well, it's very easy to understand. Let us imagine on the other side of the table. Here, we have been at some or other time of our life, we have been to some doctor as a patient or as a relative of some patient. So definitely we have got some expectations from that doctor. And yes, we want all these qualities, but let me tell you one thing. I hope all of you will agree that on the top, we need two qualities to be there in that doctor, that he should be caring and confident. I'll elaborate it. Caring means that when you are talking to him about, when you are telling him about your problems, you must feel that yes, he is interested, he is taking a lot of care of you, he is interested in listening to your problem or treating you. And more importantly, whenever he speaks anything to you, whether he asks any question or whether he answers to your question or he explains you about the disease or whatever about the prognosis, he should look very specific and confident. So believe me, there's these things. I know that yes, all these things are essential, but just imagine that your doctor is quite gentle, quite sympathetic, quite kind, but he's not looking confident to you. What will you do in that case? You'll simply switch over to somebody else, because this is not the time that in your town there is only one surgeon, one physician, one gynecologist, one orthopedician. Plenty of options are available nowadays. So all the youngsters, and these two words, let me tell you one thing, that even I'm still learning all the things. It's not so easy to learn these two qualities. You cannot learn them overnight. It takes a lot of practice, lot of thinking, lot of training, and that is what the today's topic. So that is why this concept, if you feel, and that is the reason why this communication skills training is not successful, because many times people feel, no, I don't need any training because I am quite gentle, quite sympathetic. I'm sure that by the end of this lecture, you will come to know that these two words are much bigger than what they seem to be in first instance. So this is something and yes, it is not, see, you're not taken your laptop or your bike or your car to any doctor. It's about your body and your life. So nobody will compromise. Nobody will, it's not that if something goes wrong and he'll simply say sorry and matter will be over. So these two qualities, if they are there, then only you can become a successful doctor, especially if you are a beginner. And that is the training I'm talking about, all that training. So I always say that whenever during the brief conversation between doctor and patient, the assessment is done from both sides of the table. Doctor assesses about the disease, about the problem, about the suffering of the patient, and at the same time, simultaneously and silently, patient assesses the personality of the doctor. He decides that whether he would like to continue the treatment with this doctor. And if we ask about the another misconception, if you say what are the hazards of poor doctor patient communication, again people will say patient the violence against doctors, or patient filing court case against doctor. Okay, that's a different thing, but do not forget the hidden part of the iceberg. The major drawback, the major hazard is that patient is not turning back to you. He's coming only for the first time. He's talking to you. He told him that yes, you need some surgery, and after that he disappears. He goes to someone else, then to someone else. So he keeps on moving here and there. And this is what I say. This is the biggest hazard. And you can understand, all of you, you're a medical student, you are going to be a doctor. Nobody would like that this let's say, after having so much knowledge and so much hardship of so many years, the patient is not turning back to you. That hurts a lot. Just to confirm, Ravan, everything is clear? Am I audible? Please confirm.
Yes, sir.
Okay, thank you. Thank you. Voice quality is clear? Quality is okay?
Yes, sir. You're clear, sir.
Fine. Thank you. Thank you very much. So I have given a theory of cereals and spices. You know, the knowledge that you get, that is of cereal, like, you know, it's like wheat flour or rice. If I give you a bowl of rice and if I ask you to cook something, you'll cook some or the other thing. Yes, I agree. That will be nutritious, but that will not be palatable. To make it palatable, you must add some spices in it. So whatever knowledge you are gaining in all these years, that knowledge that is actually that or theoretical or practical knowledge, that is like only wheat flour or rice. And the communication skills, these are, it's like some spices. So alone knowledge cannot do anything, alone skills cannot do anything. You must have a proper combination of both to make a very nutritious and palatable recipe. So when I was working upon it, then in 2016, I had gone through many papers and many books, articles. There's one very interesting, very nice line which I quoted. I got it from here, which states the current status of medical education, because we are talking about the education system. That in India, we greatly deal with head, meagerly with hand, and nearly neglecting the heart. 3H: head, hand, and heart. These are the three principal domains of learning. Actually, they are cognitive, psychomotor, and affective. Don't worry, I'm not going in the high technical words. Even rather, I'll explain you what is the meaning of head, hand, and heart. Whatever knowledge you gain in your lectures, in your theory classes, that everything goes in your brain. So this comes under first stage, head. Right from the day one, you get theoretical knowledge, anatomy, physiology, then you go for pathology, pharmacology, surgery, medicine. Then you move one step above, then you become an internship or you become a postgraduate student. On that time, all these cutting and stitching and dressing and everything, which needs your hand skill, the psychomotor domain. This is again, you get a training or proper training of this domain also in medical college. But how to deal with a patient, how to deal with an illiterate patient, how to deal with a talkative patient, to a silent patient, to an irritated patient, how to break the bad news, all these things. I'm sure that nobody, if it is like that, I'm very glad. But mostly in traditional teaching, there was no systematic teaching of this domain. It was not taught separately, like, okay, I'll teach you anatomy, I'll teach you physiology, I'll teach you how to cut, I will teach you how to stitch, but I will not, nobody taught in a different, in a very systematic manner, that how you are going to explain, how you are going to ask the questions. So this is the meaning of that beautiful line, that we have neglected the heart for so many years, but still we learnt it, and this is how we learnt. This domain, it's caught, it's not taught. You'll have to catch it. How do you catch it? You just catch it by observing your teachers, observing your seniors. Like a small baby, whenever he observes his parents talking to somebody, so all the words and tone and everything he catches, and he also starts speaking in the same way. So this everything was happening at subconscious level. This teaching and learning, this is how we learned, this is how we were teaching. The only thing, you observe somebody communicating with the patient, how he asks the question, how he explains, how he convinces the patient, all these things you silently observe. So everything about you right from the language to body language, this everything was gained subconsciously. But unfortunately, this is not this was not enough, because it's a subjective thing. It all depends that how much your perception is there, how much you are attentive, how much you are attending. So everything was very vague and very random for so many years. But thanks to the policymakers and to higher authorities, they brought a new subject in existence just a few years ago by the name of ATCOM module. Earlier it was ATCOM, ATCOM. Now it is again ATCOM, but it is AETCOM. It is for Attitude, Ethics and Communication module, which has been started from the 2019 batch. And this module, this is a very beautiful module. I would request you, all of you, that you must go through. It's very easy. You can get it. There was a booklet which was published in 2018. It's a voluminous booklet, but you can very easily get it on Google. And if you see the section 2 of this booklet, it will tell you that it is what is the content. First of all, it is, yes, it's a new subject, but it is not a subject for just 1 year. Like, anatomy is for first year, physiology is for first year, then pathology for second year, surgery for final year. No, it's not like that. It's right from first year to final year. It's a longitudinal subject. As you can see here, that so many modules and so many hours. The most important thing, official hours have been given, 140 hours total. So they have stage wise, they have what is to be taught to first year student, to second year student. So all these modules, all these contents have been very beautifully divided in that booklet. You must go through it, especially if you are from 2019 or 20 batch. And this is, as I said, it's a longitudinal. It's not for 1 year. It's throughout from MBBS first year to final year. It is not like only lectures or only practicals. There are so many things that have been given, and plus, yes, I'm sure that so many new innovations will. It's a also be done here. It has got lectures, demonstration, group discussion, panel discussion, video recording, presentation, and all the things which were. Hello. Yes, please confirm. My voice is clear. Voice is clear. And any interruption?
Yes, sir. It was fine, sir.
Okay, fine. Thank you. So all those things which we are talking about the doctor-patient relation, about the ethics, about communication, I'm just giving you only few examples. But even more than that, what is confidentiality? What is consent procedure? What about the euthanasia or mercy killing, and how to deal with not only with the patient, with the your hospital people, with the pharmaceutical people, everything is there. So all these things which were either not taught in such proper way and not up to that level. nobody had thought that the doctor hospital relationship that will be taught officially during MBBS final year. It didn't happen earlier. So I'm glad, first of all, that yes, this module has come and it has got so many things, and naturally the outcome will be definitely, it will be different, because right now, up till now, what was happening, that was everything was going subconsciously. We were learning, all of us learned, but it took some time. Many things people learned after coming in the practice. Many things they learned after committing some mistake. So now there will be a platform for the teachers also to teach the students in a very systematic way. So teaching and assessment, everything will be very systematic after this ADCOM module. Unfortunately, because as you know, the moment at the same time this pandemic also started, so I'm sure that what was thought earlier, it has disturbed everything. But still, all the colleges, I'm sure they must have tried, if not offline, then through online or through hybrid mode. So some or other thing has been done, and I'm sure that I hope that very soon everything settles down, and we come or we implement this module in all the medical colleges as it was expected. This is a place where I'm working since last 10 years, and apart from my usual subjects, this doctor-patient communication has been my favorite subject. And first of all, let me thank all those medical colleges and hospitals who invited me, who gave me the opportunity to make some presentations and workshops. Obviously, it was in pre-COVID era. And more I kept on visiting in different cities and different states, more I kept on learning, more I kept on exploring, and more I've felt that how badly the subject is needed. So in the same, with the same purpose, I was successful in constructing a communication skills lab in my institute in 2015, 6 years ago. Means ADCOM came in 18, but thanks to the God that luckily I started working very early. So in 2015, I had established a communication skills lab in my institute. I'll come back to this slide, but what was done here, you can very easily get it. One article has been published. You can get it on, it's only 3-4 pages article, and you'll have to just type communication skills lab along with my name on Google, and you'll get it on the top. So this module, this lab was used to teach students, MBBS second year students, about all the communication methods in very different and innovative ways. Like as here you can see, just to tell you a few things, he's not a patient, he's actually a dummy patient. A normal person who has been given a script, and she's a medical student, she's taking his history and it is being recorded here. Well, the one good thing about a dummy patient is that you cannot, you can expect them to communicate with a large number of students. Otherwise, if you imagine that if a patient he gives history to 1, 2, 3, 4, 5, 6, he'll get irritated after some time. So the patient, she takes the history of the patient, it was recorded, then I used to watch that clip, I used to give that clip along with my feedback, that what was your strength, what was your weakness, what about your language or body language, what point needs some improvement, and other things like this is my video, and this is patient's video, real patient's video. So everything was demonstrated to the students 6 years ago. And I was glad that they gave a very positive feedback, which has been published in this article. It was done in different batches, but again, because on that time we had to somehow take out the time for this thing. This was because this was done only in the routine day and routine time, so we had to take some time for this extra teaching. So this other thing which I am glad that after ADCOM, all these things will be even better, because now you'll get an official time to teach the students in a proper way for their teaching or for their assessment. Now, the other thing which I say about the history taking for any medical student or for any doctor, I have given a theory of 3 pillars, that the whole art of history taking can be learned by understanding 3 questions: what to ask, why to ask, and how to ask. The first one is very easy. What to ask, you all know right from the very beginning, we get a format, we get some format of history, pro forma, presenting complaint, and personal history, past history. So many things are there. So this is the questions are very well known to us. Why to ask again? It's quite easy. You ask usually to make mostly to make the diagnosis of the disease, or if not diagnosis, then to plan the management. Some questions are asked to plan the management of the that disease. But the most important, most difficult, and most undercovered part is how to ask. Now, I'm sure you'll believe it. And this is one thing which is, again, the students in traditional teaching, students get a proper knowledge of these two pillars, but they don't usually get a proper or a systematic knowledge of this pillar. Well, let us take an example of just one common question which comes in personal history. Say it's the history of addiction. I'm sure you'll agree with me that if in your OPD you're getting a 60 years old, some illiterate male patient, and just after that you are getting a 25 years old, a graduate female patient who is educated 25 years old. Now, you will not be able to ask about the addiction to both of them in the same way. It needs a lot of difference, not only in the selection of words, but in your tone, in your body language. Means it's just an example. So you cannot use the same pattern with each and every patient. It depends on the age, it depends on the gender, it depends on the intellectual level of the patient. So this particular part has been neglected a lot. And this is the one part which I say, as I told you about two words in the beginning, caring and confident. And this is what makes you look confident. If you know how to ask, if you know how to communicate with the patient, then only the patient will get impressed by you. Otherwise, if there are a lot of fillers and fumbling, if you're talking to the patient and you're struggling, you're trying to find out the words, you're trying to find out the suitable way to ask the patient, so naturally nobody will get impressed by you. And this is what happens. This is what happens, that even I have seen that the students who are who can impress their teachers or examiners in exam, but they fail to impress to an illiterate patient. Once recently somebody asked me that how did you do all these things about the history taking, and how did you go in that much depth? I simply said one thing. I said, see, I went inside the kitchen. Now that sounds very strange. Inside, what does it mean? Inside the kitchen. So you go to the restaurant, you go to the five-star hotels, you go everywhere, and there you order the food, you sit in the dining area, and the waiter comes, he serves you, and you enjoy your dinner over there. But you never know that how it was prepared. You go to the washroom, but you never enter in the kitchen of that restaurant. So this is what I did. I went inside the kitchen for many months and many years. I used to observe the student. I used to ask my students to take history in front of me. Otherwise, traditionally, what usually happens that the student goes, he takes the history and he comes and he presents to his teacher or examiner. So what exactly happened there? Everything I observed live. Then I talked to many students, I talked to many patients, many relatives of the patients. What was their problem? How did a patient feels when a student talks to him? So for many months, I did a research on this topic, and after that, I came to write a book on this subject. So this is one pillar which I would say that everything is based on this thing. If you know that how to ask, and again, it is not, you cannot learn it just in few days. That okay, first I'll get the knowledge. I get my I'll feel my head and hand. Then I'll pass the exam. I'll get the degree, and then I'll learn. Well, it's good to learn from the mistake, but it's always better to learn from others' mistakes. So this particular question, that how to ask, it is the main pillar on which I've been working for so many years. Well, Raven, just to confirm about the audibility once again, I'm audible?
Yes, sir, you're audible, sir.
Okay, thank you very much. Okay. Now here comes, now you got a subject, you got students, you got teacher, you got desire to teach, you got desire to learn, but what do you need? If so many things are there, then it's good if you got a literature also, some book also. Now, this is the thing which I always say, that all around the world, we people have got common anatomy and physiology, but not the culture and tradition. So if there is any book on anatomy or physiology or medicine or surgery in any part of the world, we can replicate it here. Or on the other way, suppose there is a book from our side, that these people can very well use it if it is on these subjects, with maybe with some little modifications. But since the communication largely depends on culture and traditions, plenty of literature is available. I'm telling you, Google, and I'm not talking about this time, even when around 9, 10 years ago, when I started working upon this subject, so many books are available. But when you read those books, in all those books, you always felt that yes, the culture, it was from some Western culture, because they were from Western origin. So I'm sure here also you'll agree that you imagine some rural person from our country, 60 years old, 70 years old rural person, and the same rural person from some place in the UK or USA. So all the communication, everything which you will ask, they'll differ, because our culture and tradition, they are quite different. So we need something of our own. This thing cannot be replicated. This thing, if you read, you can learn, but still, if it will be better if we get something of our own. Thanks to Almighty God, thanks to all my teachers, all my students, thanks to everyone, that I succeeded in writing a book on this subject. The first edition was released in 2014. The second one was released in 2016. And I'm glad to inform that very recently, the third edition, this is my third baby. The third baby is born. Thanks a lot to the team of JP Publication, because even in this pandemic, COVID pandemic, they all worked very nicely, and only because of their hard work, it is possible that it came into existence. Obviously, it was delayed by a few months because of the COVID. But finally, this third edition, which I have tried my best to make it on ATCOM module, because the second edition was in 2016. By that time, the ATCOM was not there. But when I started writing the next edition, I had a module in my mind. So I tried my level best that as much as possible, or as many modules, if I'll be able to, because ATCOM is a very big module. You cannot cover all the modules in a single book. But still, many books, maybe in future, if I write next edition, I'll try to cover the remaining modules also. So this is the poster of this book. You will very soon you will get it. What are the contents? But I'll just take you to a brief journey of this book, inside this book, and along with that, I'll tell you that what are the various aspects of doctor-patient communication which is required, or which should be known to a medical student. This book has been divided in 5 sections, and there are overall 24 chapters are there. I'll come to these sections later. I have included 98 interesting cases in this book. They are in box form. Well, let me make a very clear, although it is written in disclaimer, and I have never revealed the identity of any doctor or any patient or any place in any of my examples. But if you read these examples, you may sometimes feel like deja vu, that yes, it has happened with me earlier. Yes, the same thing I have felt. This was it resembles to my case or that case. That will be only purely a coincidence. Otherwise, I have not revealed anybody's identity. So that is only to make it more memorable to you. One more request which I would do, that if you read these are printed in box form, but please, whenever you are reading these cases, please read this paragraph also, just a few lines ahead of it, because if you directly read it, probably you will miss that what is actually what is the message. So first read these few lines, and then you read the examples. So I'm sure you'll definitely, and these are very easy way to remember the given message with some examples, and they are I won't say all hypothetical. They may be, some are hypothetical, some are inspired cases, or sometimes when I'm meeting some doctors and somebody sharing some experience with me, and I get an idea, okay, by this example we can make a story, some new story, a short story. So gradually, by adding more and more, I'm just very short, just too short of a century, but anyway. And the second thing which I included, obviously the images, they speak better than words. I used multiple photographs also, that how to, what are the do's and don'ts, what are the common mistakes which we do in communication. And as I told you earlier, that to learn from mistake is human, but the smartness is to learn from others' mistakes. And this is the role of any teacher. And this is how experiences matter. because a teacher, experienced teacher, he observes more mistakes, then he teaches the next generation of the students about those mistakes so that they don't repeat it again. So this is a way of learning. You always, and it's always better, and that is the reason if I want the students to learn from others mistakes, not from their own mistake. So let us briefly go through these five sections of this book. The first section is about the doctor-patient communication itself. That first is what is the role or what is the meaning of being a doctor, which is the first chapter of AdCom module. The meaning of being a doctor. What is your role in the society? What are your expectations? What you have to do actually? So that thing is in the chapter 1. The chapter 2 is little bit emotional chapter, but what is the meaning? What are the sufferings of the patients? If you want to become a real doctor, a successful doctor, then you must look beyond the physical suffering. So suppose a patient is coming with pain in abdomen. You may feel, what is the complaint? Complaint is pain. No, that is not the only complaint. Or if patient has got loss of appetite, so it is not the only complaint. You should look beyond the physical problem. You should look at the mental stress. You should look at the financial stress. So all those things which the patient and his family that they go through in that phase. And as I said, the life is very difficult on the other side of the table. Well, all of us have gone through it, especially in this last 1 or 2 years, that we know that what does it mean to be a patient or to be a relative of the patient. So that thing is very deeply elaborated in this chapter. In third chapter, it is about the how do you make the diagnosis. The patient comes to you with some complaints which are called as symptoms. Then you examine, what you find, they are called as signs. You combine signs and symptoms, you make a provisional diagnosis. Then if required, you ask for some investigations, and then you proceed for the management. So all these things, that how these things are done, what are the hazards of investigations, when to use it, what is the benefit, and what is the hazards of overuse or misuse of investigation, that everything is given in the chapter 3. Second section is, I would say, it's a general section. It's not related to the medical science. It is something, it will tell you all about the physiology of communication, the process of communication, what are various channels of communication, what are the modes of communication, barriers of communication, face-to-face conversation, text communication. Means everything which happens, if you have to understand the word, what is the meaning of communication, that you'll understand in this chapter. And next to it comes the various elements, the verbal, paraverbal, and non-verbal. Paraverbal is one word which is not heard by many people. People know verbal and non-verbal. So verbal means words which you use. Paraverbal means all the tone, volume, speed, everything comes in paraverbal. And non-verbal, which is popularly called as body language, which includes various elements like your gesture, posture, facial expressions, eye contact, and few more. So all these things, that how do they affect, what are the common mistakes which are done, unintentional mistakes which are done. And I would say that this knowledge will improve your personality, not only as a doctor, but in your social circle also. When you're attending a meeting, or when you're talking to your friends, or when you're talking to some, any other person in your life. So that will be how to behave there, how to use improve your body language. What are the methods to improve your body language? That everything is given in this chapter. Third section is the major bulk of this book, the biggest section, and all these things very well known to us right from the very beginning, right from the infancy of our student life. We know these words: past history, personal history. But everything, 90% of the chapter is focused on this question: how to ask. May it be a menstrual history, that how do you ask about the last menstrual period? May it be about the drug history, if it is about the family history, or whatever. What are the common problems which are encountered by the students, especially in the beginning? How to overcome them? How to make your conversation smooth with the patients? Because the first early phase is very difficult phase, that when you are not trained properly, so you need some with experience you get improved. But if you go through all these things before going to a clinical posting, so that will definitely help you, that what are the common difficulties you may encounter and how to overcome them. Next is again dedicated to the students. The most exciting phase of our life when we go to the medical college and when we go in the second year for the first time, when we step inside the ward and we take the history of a patient. Because in first year we deal with the cadavers, but we deal with the live patients only in the second year during our clinical posting. So that history taking part, what is the again what common mistakes which happen when a group of students they go to take history of any patient, or a single student when he goes to any approaches the patient. So common mistakes which are unintentionally done by them and how to overcome them. Moreover, there is a big difference in history taking of a medical student and a practitioner, that you all know, because the way you take history when you go to any doctor, you all know that the doctor doesn't take that elaborative history, that detailed history. And the thing is that you have to spend only a small part of your life as a medical student. For rest of your life, you will have to be like a doctor. So you should know, yes, student life is important, but here you should know that what is the difference in communication between, or a student patient communication and doctor patient communication. What is the difference? So that difference has been elaborated in this chapter. And yes, it's a dream of every person to impress the teacher, to impress the examiner, to make a beautiful presentation of case history in the clinical posting or in practical exams. So again, same things, difficulties, mistakes, and how to overcome them. So there everything has been compiled in a single chapter, how to take and present a case history. And next to it is a hypothetical case in which there is a conversation between a student and a patient, word to word, line to line, question to question. Everything has been given. So when you read it, it will be just like that, as if you are taking history of any patient, and each and every word of that has been recorded. So that illustration will help you to understand that how we have to, or how that particular question, that how we have to ask all these things. That will be clear in this chapter. And final section, this is, I would say that this is mainly for medical practitioners. But again, every practitioner was a student once upon a time, and every student has to become a practitioner, has to be a doctor in near future. I wouldn't say remote future, just few years, and then you will be doctor. So it is at this stage only you have to, because AdCom is there. So AdCom, that's why I'm glad that AdCom is telling you all those things which you are supposed to do as a doctor. So that is why it's a proper time to learn all these things right now, not after getting the degree or not after going in the practice. So these 6 skills, one chapter for every skill. The first one is listening skill, the most important one. Yeah, Ravan, please confirm. Voice clear? No interruption?
Yes, sir, you're clear, sir.
Okay, thank you. Thank you. This one thing, I kept it on the top. Listening skills. I've studied so many, when I was working upon this topic, so many papers and articles, and I found in most of the articles, what was the highest or what was the greatest reason of dissatisfaction of any patient in any country. I'm not talking about our country only. That they felt that doctor didn't listen to me properly. So now naturally you cannot spend a lot of time with a single patient, because there are many patients who are sitting in the waiting room also. So those few minutes in which you are communicating with your patient, you are taking history of your patient, even if you spend 2 minutes or 3 minutes or 4 minutes, how to make any person feel that you are listening to him, have you listened to him properly. This is the most important thing when we take lectures, and the audiences, they are sitting in front of us, and so the students, if they have got good listening skills, we get encouraged. We feel like, okay, yes, we are going in the right direction. So again, how to be a good listener. I remember I told you one thing, the caring word is very important. And remember this thing also, that it is the patient who speaks first in clinical practice. Doctor only asks one question, that okay, what is your problem, and patient starts telling him his problem. So doctor first, he has to act as a good listener and then as a speaker. So how to improve your listening skill? It's not only by just head nodding or just making some vocal cues. What are all those things which will make you 7, 8 methods which will make you a good listener? That everything you will find in this chapter. Second is the questioning skill. The questioning, it is the most primitive thing, and in fact, it is the only thing which is done in the student life, because when you are a medical student, you take history and you are supposed only to ask the questions, nothing beyond that. You cannot explain anything to the patient. You cannot give any answer to, you are not authorized and you are not having that knowledge. But the questioning is also question. When I started working upon this, even I didn't think that it needs so much, or it has got it may be having so much of content. What are the different types of questions? What are open-ended questions? What are closed questions? What are leading questions? When to use open-ended? When to use closed question? What is it? What should be the depth of questioning? What is the relevance of questioning? What is the feeling of the any patient when you are asking any question? So all these things, it has, you have to, because you need to have a perfect combination. You can get a good answer only if your question is good. And that can be improved if you got a knowledge of that thing. Naturally, this will guide you in a proper direction and it will improve. So this is about questioning skill. Next to it is answering skill. Now, after medical student, when you become intern, then you become a PG student, and then you become a doctor. So as your level increases, now you are expected to give answers to some common questions of the patients. That also needs some skill. How to give an answer, how to skip an answer, because if at your level, suppose you are not sure about it, or it will be dangerous for you to give any answer, then how to skip that question, how to handle that question, how much to speak, how much or not to speak, everything will be there. That comes under the heading of answering skills. Next to it is explanation skills. Yes, it's a right of every patient to know about his disease and the treatment. It's the right has been given in our, it's a legal right. So that's obviously it is our responsibility to tell him. And let me tell you one thing, it is not an easy job. You're not explaining about the disease or about the treatment to your teacher or to your examiner. Remember that you have to explain. The teacher and examiner, they're only for a few years in your life. You have to explain it to a lay person who has got no knowledge of medical science, who has got no knowledge of anatomy and physiology, who has got no knowledge probably of English language also. Now, suppose there is a case of BPH, benign prostatic hyperplasia. If I'll ask you what is BPH, how will you treat it, you may tell me everything fluently in Viva. But if the same thing, if a patient of BPH or a relative of the patient, he asks, sir, what is the problem and what you will have to do, you will have to explain. And that is the real difficulty. So how to overcome this thing, how to impress, and if you don't explain, again, repeatedly, I'm telling you that it is like, don't forget that submerged part of iceberg. If you couldn't explain properly, he'll get lost. He won't come back. So what are the various methods in which even a lay person can be explained about the disease or about the treatment process? So that everything will be in this chapter of explanation skills. Next one, I would say the most challenging is the persuasion skill or the convincing skill, how to convince a patient. If there is a surgeon, if he has done thousands of surgeries, and I'm sure that if suppose any day a surgeon gets some problem and somebody else tells him that, okay, we'll have to operate you, or you need some surgery for it, I'm sure the first thought that will come in his mind will be, can it be avoided? Life is really very difficult on the other side of the table. It's very easy to say that it needs surgery, it needs admission, but it's not so easy for the person to accept it. Nobody enjoys being operated. Nobody enjoys being getting hospitalized. Nobody enjoys to spend thousands of rupees on some costly investigations. So you have to convince, you should know that how to convince that patient. How to convince, because you're not lying, you're not fooling him. Yes, this surgery needs, if he has got hernia needs surgery, that is the truth. But he is not convinced because it's a painless condition, it's in the most concealed part of his body. So he will not trouble, he will simply say one thing, that okay, no problem, surgery avoid, surgery avoid. So how to convince a patient? Otherwise you'll lose the patient will keep on avoiding the things, and he'll keep on opting some easier way, some easier remedies, which is not costing that much. So what are the reasons why people avoid? It's not only the fear of pain or fear of anesthesia. There are multiple reasons that why do people avoid. Even we also avoid. If there is somebody says you need to be hospitalized, you will not say instantly, oh, that's a good thing. I'm glad. I'm happy to be hospitalized. So how to convince any person, any patient to accept the treatment, the desired treatment or the required treatment, that comes in the persuasion skills. And last but not the least, when you examine any patient, when you do the palpation of abdomen or any swelling or anything, even it needs some points of communication. It's a very small chapter, but I deliberately kept it in a different form. So this will also tell you that how, while doing examination, how your communication skill that will help you in improving your bond with your patient. So that is something which I'm thankful to once again all of you, thankful to the JAYPEE publication, thankful to the SMR, all the organizers for organizing and for inviting me on this event. And more than that, I'm thankful to all the readers of previous editions of my book who gave me the feedback, positive feedback, suggestions, so that I was able to incorporate something new in this edition. And I'm sure that you'll definitely, this edition will fulfill all your expectations, and it will help you, help all the students and the young practitioners to learn all these things which we were learning subconsciously so far. So many things you will be able to learn through this book easily. And this is one line which always inspires me the most. The biggest hurdle in the path of human growth is the thought that you know it all. Remember that I started with one thing, that if you say good communication skills, so please don't say that I'm gentle, I'm polite means communication skills is all. Communication is much, much more than what is being taught for so many years. And I'm glad that ATCOM module is there. I hope that now we get a platform, we get a time to make a systematic training of this module. And once again, I apologize all of you for not being able, because of that technical problem. My webcam was not working, so I'm not visible to you. But as I told you in the beginning, that my slides and my speech, they are more important. So I hope that I am succeeded in conveying my message to you. Thanks a lot. Over to you, Rehan.
Thank you so much, sir. It was truly a wonderful session.
Thank you.
Shall we take some questions now, sir?
Yeah, most welcome.
Yes. So the first question is, sometimes during history or even when a clinician asks a patient about, past history or something like that, the patient goes on telling some unrelated event related to his history. So how can we, as students or even as future clinicians, how can we keep a track of this and, ensure that there is efficient use of time and we elicit only the required history from the patient, sir?
Very nice question. I would appreciate, and I would congratulate. And the person who has asked this question, yes, this is a big problem, especially for the beginners. And even if I've seen, even if the patient or the people who are not by nature talkative, who are not very talkative, but when they talk to a medical student or to a doctor, they start speaking a lot. And sometimes, if it is related to the disease, that is fine. You keep on noticing the points. But the worst thing is that if it is unrelated, in this book, there is one interesting history also, that how a patient has given a history that he went to some marriage and there was a problem and so and so. Yes, this one thing is, if you stop the patient, if especially a young inexperienced student, he stops the patient may get annoyed. And if you don't stop, then definitely time is important for you. Time, you have been given 30 minutes or 45 minutes or whatever. So if that time is spent, so there's one thing I would say, yes, it comes by experience. But even I have written a few things that you make some interruption, your body language, and by some way you can make that person feel that, okay, come on, let's come to the track. So you won't have to stop him, you won't have to scold him, but at the same time, you won't have to, you can't allow him to go randomly here and there. So there's a big problem. Even, yes, I know sometimes some people, yes, in these communication skills lab, I have got some videos of talkative patients.
Yes.
The patient is not here now, but that video is still with us. So the patient is so talkative. If we play that video, the students will really feel that, oh my God, if this patient, if you take history of this patient, it's very difficult to stop him. So that will definitely come by experience. But more you'll do it, more you'll learn that how to handle these such patients.
Yes.
Yeah.
So another question.
Yeah.
So sometimes few patients have fixed notions about how few things work. So even if as a clinician, if we give a prescription or tell something patient to not to eat that or not to drink that, patient has some fixed notions and he continues to do that, and he doesn't follow the prescription, sir. So in these cases, how can we convince the patient to our level best that it's for the patient welfare, and how can we for at least for to a certain extent tackle the issue at hand that the patient is not going to obey the prescription, sir?
Well, it depends on 2-3 things. Number one, that how serious is that condition. Number two, how much time you have got. Because as I told you, time is also important in doctor-patient communication. If if the patient is not following your order, ideally he should follow. But yes, this happens. I'll tell you one very interesting example which I always quote. You know that there is one everybody says in the family that if you have got any wound, then don't eat anything sour, like you don't take lemon or don't take curd.
Yes, sir.
Now, see what happens. What medical science says that vitamin C is good for healing. But what our traditions say that if you have got some injury, and why it happens, I'm not going in that detail. But there are certain some myths, some beliefs, some misbeliefs with the patient. He will not follow what you are saying. So I'm not saying the one thing is that is it very dangerous? Is it very harmful to do it or to not to? Is it very essential to do it, or can it be dangerous? So if it is that, then you have to dedicate. But if it is like it doesn't make much difference and you don't have that much time to convince the patient, so in that case, if it won't harm, you can at one stage you can give it up. So we cannot make a generalized rule that and yeah, one more thing that yeah, it's a common thing. The patient, when the patient comes back, you should, it's one common thing when the doctor gets angry that why didn't you follow this thing, why didn't you do that thing. So just see that if it is very hazardous, let the patient know that what hazard has happened. But if it is a mild thing, if he has deviated, I will recommend that it's better to ignore all these things. It's a part of human nature. Even we do the same thing. If we are on the other side of the table, sometimes we also do the same thing.
Yes, that's true.
Yeah.
So one more question.
Yeah.
So being medical students, sometimes it's difficult to elicit some menstrual history and some personal history related to habits and addictions. It would be comparatively easier in cities, but yeah, if we go into the interiors or the rural areas, it's pretty difficult even for medical students or even sometimes clinicians too. So how to go about this and your thoughts on this?
I would add one more thing. It is more difficult for male students, right?
Yes.
Yeah, it's obviously it's more difficult. Yes, what you said, that is very correct. See, menstruation is it's a physiological but a personal phenomena. And what I say, there is some kind of hesitation. You talk about addiction or you talk about menstruation. Obviously, there is some hesitation on both the sides. You cannot talk so openly. So what I suggest, number one, first of all, you remember that you are a medical student, you are a doctor. If you are asking to any female patient about menstruation, she'll definitely hesitate. It's a natural thing, but she will not mind because you are a doctor or you are a medical student. It's a doctor who is asking. It's not any XYZ person or any person who is going around and he is asking that lady about the menstruation, or somebody is asking you about your personal life or about addiction. So first thing, the hesitation is there. So even if you are a male student or a male doctor, some other time it's not a crime. Number one, it's not a crime. You're not. This question is there, and there are reasons that yes. In my book, I have given there are multiple reasons why. What is the importance of LMP? It's not only about the pregnancy. So many other things. In so many other things, LMP is important. So first of all, hesitation, if hesitation is from your side, first of all, try to overcome this hesitation. If you are a male student or a male doctor. Number two, you on this time, what you do, you remember one thing, you just, because as I told you, it's a physiological but personal phenomena. So when you're asking about the menstruation, just lower down your volume. When you're talking, when you're asking, don't whisper. I'm not saying just whisper, but when you're asking some personal question, just lower down your volume a little bit. Whether it's for addiction or menstruation, the person appreciates a lot that this doctor, he wants to know about my problem, but at the same time, he is giving respect to my privacy.
Yes.
So that is what is thing. But yes, there is some hesitation is there, and you have to overcome. You should not be very bold or very open, and you should not ask loudly about all these things. your volume should be a little bit low, so the patient will appreciate you.
Thank you, sir.
Yeah.
Sir, one more question.
Please.
How can we balance the amount of time we give to one patient and the patient load? So because many times it happens that junior doctors and even clinicians have to manage a huge patient load.
Yeah.
But if we give maybe say 30 minutes to one patient and we treat them holistically, it might take more time, and that's not feasible to and practical too. So how to go about this kind of situation, sir?
Well, see, the time, sometimes it is. I just read a joke somewhere that that what is the time? If you want to know about the time, so example was given of the toilet. If the person is inside the toilet and one is outside the toilet, so what is the importance of time? You just ask the patient who is outside the toilet. The same thing, although it doesn't look a suitable example, but the same thing is that when a patient is inside doctor's chamber, he will try to spend as much time as possible. But if the same patient who is sitting in the waiting room, for him, he has to, even if he is not having any acute problem, but he has to wait for a long time. Thanks to the mobile, to some extent, that nowadays the people are engaged in the waiting room. Also, they are spending their time on the mobile. They don't get impatient so easily.
Yes, sir.
But yes, one thing, a few doctors, I heard that few doctors, they limit the time. That obviously the senior doctors, they limit the time.
Yes.
I heard about them, that only consultation will be only for the 10 minutes or 5 minutes. So again, we cannot make a rule, but we should not forget this thing, that if patient is taking excessive time, this is what is called as smartness. Because those who are waiting outside, I told you in the listening skill that if you spend 30 minutes in every patient, now just imagine you've got 6 patients outside and you are giving 30 minutes to one patient. Now when the 6th patient will come, he'll have to wait for hours in the waiting room.
Yes, sir.
So yes, that is one thing which I agree. And again, it will need this is what is smartness. How to stop the patient from talking excessively, or how to stop the patient from taking excessive time. Because you are not avoiding the patient. You are at the same time, don't forget, you are just cutting short the waiting time of other patients also.
Yes, sir.
Fine? Yeah.
Yes.
Anything else?
Dr. Rohit Kumar Pal asks,
Yeah.
how to take history when the patient is a family member or a relative or a friend, because they get too annoying too much. Now, how to deal with that?
Sorry, can you repeat again the question? When the patient is?
How to take history when a patient is a family member and friend of ours? Because they get annoying, sir. He says so how to deal with that, sir?
Well, sorry, I can't answer here, because this video you will upload on YouTube and my family members and my friends, they all are going to watch it. So I cannot take a risk. But yes, this is one thing, not actually annoying. I would put it in a different way. The family, they expect a lot from you. The family members and your friends, the moment you step inside, many of you are medical students, the moment you are inside the medical college, you are a doctor.
Yes, sir.
And they expect anything from you. Yes, this is one, everything. Even if you become a doctor, you are a pediatrician, no, you should know about this also, this also, this also. And you won't get anything in the payment except for the blessings. So I will correct this thing that and see, annoying anybody can be annoying. Any patient, any unrelated person, he can be annoying to you. But the family members, in that case, the only difference which I feel that they take a lot of time, they expect that yes, because we are you are our family member, you are my son, you are my grandson, you are my nephew, so you should give me you should pay all attention to me. So otherwise, I don't feel that only the family member can be annoying. Annoyance can be at any level. And that too, yeah, but here I would suggest you one thing, that never cross your limits. Never ever cross your limits. Never hesitate in answering skills. I have written one thing: never hesitate in saying no. Because you are a doctor. Whenever the COVID time, I'm sure all of you must have experienced so many things. People ask about COVID, and to whom they'll ask, okay, in my family, I've got a medical student. Okay, he knows better than us. We are not we are not doctors. We don't know anything about medical science. Let us ask him or her. Now, whatever you will say, they will feel, no, if he has said, then definitely they'll just seal it. So if you don't know anything, don't hesitate. If it's not in your field, don't hesitate. Tell them, this is not my field. refer them to the specialist, or at least talk to some specialist and convey his message. Because this is one, sometimes I feel this is one problem, just to save the skin, or just to get just to save yourself from this shame, sometimes we give a half true answer, and that can be sometimes dangerous for your family member.
Yes.
Fine, over to you. Yeah.
Yes, I think that's all the questions we have for you, sir.
Thank
Thank
you.
you so
Thank you
much,
very
sir.
much. Thank you very much. And once again, I thank a lot to everyone. And I hope it was very nice and very interesting experience for me also. I wish to have more questions in the future. And yes, one more thing. In this book, I have given my mail ID also. So if you got any query or any suggestion when you read this book, please share it with me. I'm not the only author of this book. Yes, I am the only author, but this book has been made only by, so the people kept on sharing their experiences, their problems, their queries, their mistakes. So many things I've got in my mind, and by that only I was able to write a book. Thank you very much. Thanks a lot. Yeah.
Sir, is this book launched on
Yeah.
Amazon or Flipkart, sir? Third
Pardon?
edition. Third edition has launched, sir, in
Yeah.
Amazon.
Yeah, it has launched. It has gone very soon. It will be available on the website of JP Publication also, and all other e-commerce sites and retail stores. It will be available there.
Yes, sir.
So yeah,
Sir, like one question was there.
yeah.
Like forgot to ask, sir. Like recently, there is an increase in incidents of violence against doctors.
I was waiting for this question. Yeah, please carry on.
Many
Yeah.
many have blamed that doctor-patient communication skills was one of the prominent reason for this. So,
Yeah.
what is your take on it, and what impact? Like, what is the impact of these communication skills on violence against doctors, according to
Okay.
your perspective?
Okay, fine. Yes, this is the violence. The question about violence itself is a violent question. It's very difficult to handle, first of all. And I was waiting. Actually, I was wondering that why nobody asked me this question. And this is everywhere in any conference, anywhere I go. This is the question is all there. It is always there. See, the first thing is that anything violence or any all these things, that we cannot make a generalized rule for that thing. Who is on fault? I'm not making any comment. I'm not making any comment that only doctor is at fault, only patient is at fault, because it varies from case to case. Government is doing the laws. There are laws, there are policies. Everything is going on. But what we can do that on our side, yes, the training of doctor-patient communication, at least on our part, that part, if you learn that all these skills to certain extent, it will make some improvement. But if I say that yes, it will stop all these things, that means I'm blaming only doctors, which is not the truth. We all know it takes two to make a quarrel. So I am not only me, nobody can make a generalized statement that yes, you need, I have written an article for the patients also. In one magazine in Hindi, I have written an article in Hindi that is for patient, that how to become a good patient. What a patient should do, what are the common mistakes which patients do when they go to the doctor. So the violence, the one thing which I would say, but definitely if you learn your part, if you learn, say for example, this listening skills, if, and what again, all the things which are written in this book, it is not only by my personal observation. All the studies which are done in top universities of the world, maybe Harvard University or Boston University or many other universities, all the studies which were done, based on those studies, what was their conclusion, and I included those conclusion in the book. That it once I found that even if you just listen, if you show your proper listening skill, a patient is coming and he's angry and he's just angry on you, and you are showing, you just listen to that. Forget about the patient, to any person. If any person is angry on you, you ask him to have a sit and just listen to what he's saying. At least let him finish. What he'll take 1 minute, 2 minutes, 3 minutes max. Let him finish what he's saying. So this is what, and this is not my personal recommendation. This is study proven that yes, you have to, when you listen somebody properly, his anger comes down to a great extent. So there's everything you will by proper training, and I hope, and yes, violence and everything in ATCOM also now naturally. Yeah, one more thing, that who is going to teach the ATCOM, because the subject is different. But what about teachers? There's no need to bring separate teachers. All the teachers collectively, all the teachers from all the departments, they can teach you. They can share your experiences. So violence, one issue. It's a violent issue, and yes, but you look at your part, or we should look at our part. Definitely, the training will make some difference. Over to you.
I think that's all the questions we have for you, sir. Thank you so much.
Thank you.
I think
Thanks a lot.
it was really an enlightening session, and it will really help us to go a long way in our career, sir.
Thank you. Thank you. All the best.
Yes. Thank you so much, sir.
With this, we have ended the JP and SMR continuous medical education program session. We have 7 days, 7 sessions with eminent speakers and author textbooks from across the nation. I hope all delegates enjoyed this. Even though the CMA program has came to the end, still we have 2 more programs in Med-Invade conference. So the next session will start at 4:30 p.m., which is a very insightful session. The session on Nest. Recently, the NMC released latest guidelines on NEET, and all students in 2018-2019 batch are in an excited enthusiasm, like what to do and how to do. So please stay tuned for the next event and get all your doubts cleared. So have a nice day. Thank you so much, sir. I will end the meeting now.